everyone, my name is Miranda Yousif. I'm a student at Arizona State University right now studying microbiology and neuroscience. Much like many of you, I am a student pursuing my academic and professional goals. One of my goals is actually to educate my peers about HIV and sexual health in a very comfortable setting. And with that said, I want to make sure that when we are talking about HIV and sexual health tonight, that everyone feels comfortable. And I know when we're talking about sexual health that it is a very uneasy topic, but I want to create as safe of a space that as possible. I know that it can get very uncomfortable, so if at any point anyone needs to get up or walk out, I will not feel upset whatsoever, so please feel free to do so. So with that said, I want to talk about HIV prevention in the ABCs. A for abstinence, B for being committed, C for condoms. So with that said, first of all, A for abstinence. What is that all about? A being the absence of penetrative sex. Penetrative sex meaning sex being defined as oral, vaginal, or anal sex. And if you are being abstinent from any of these three types of sex, you are 100% covered from HIV. Again, if you are being abstinent from any of these, you are 100% covered from HIV. However, if you choose not to be abstinent from these and you choose to be engaged in sex, you have the option of being in a faithful, committed relationship, which is what the B is all about. And being faithful is all about being educated on your partner's status of HIV. So the B in the ABCs is all about being educated on your partner or partner's status of HIV. This is not limited to two parties, so it can be extended to multiple partners, and it is all about knowing that partners have been tested and knowing their status of HIV. If A or B is not an option, condoms, the C, are also effective, are also an option for HIV prevention. They can be worn during sex, and these are one condom per partner per sex act. They are very effective at reducing HIV transmission by tenfold. There are also multiple types. There are male condoms and female condoms. Female condoms can actually be inserted hours before sex, and they are both equally effective. The ABCs can be of HIV prevention. You can go through them. You can go through them at different points throughout your life if one does not work throughout an individual's life. You're able to go through them. In addition, some populations are at especially high risk for contracting HIV, such as men who have sex with men, people who inject drugs, people in prisons or other closed settings, sex workers and their clients, transgender people, and prevention is really notable for treatment for these populations. Also, for anyone who is already HIV positive, prevention is still important for noting for preventing passing on to a loved one or a child or a partner. So it's important to reach out to healthcare professionals about antiretroviral therapy to prevent passing HIV on to loved ones. All of this information is approved by the World Healthcare Organization. So thank you so much for taking the time to listen, and have a great night.